Hi guys, today we're studying the ulna. The ulna is a bone of the forearm. It's the medial bone of the forearm. This here is the ulna. This here is the radius. The radius, I told you, just like the radial pulse that you feel on your hand, on the radial side near the thumb. The radius is located laterally, and the ulna is the medial bone of the forearm. It's a long bone. Since it's a long bone, it has a shaft or a long body, and it has two ends that are expanded. When we talk about the ulna, this is the trochlear notch that we will see on the upper end. And then this is the head. The head is very small for ulna. You remember that when we did the humerus, we had a really big head. So this is the humerus and the head was really big, right? And it was on the proximal side. But in the ulna, the head is on the distal side. See? So the head is here, which has a styloid process elongating towards the hand. We'll study it later. Don't get confused for now. But the head is here, and this is the part that has four processes, and we'll do that now. But you do remember that when we did the humerus, so this in my hand is the humerus. When we did the humerus, we had an olecranon fossa on the posterior side, and we had a coronoid fossa on the anterior side. So this was the coronoid fossa, and this was the olecranon fossa, right? And there was a very small radial notch or radial fossa that we saw on the lateral side on the humerus. So when we take the ulna, we can see that it articulates. The hook-like process articulates with the olecranon fossa. So this hook-like process is also known as the olecranon process, right? Because it's articulating with the olecranon fossa. So this is how it's articulating with the humerus. And anteriorly, you can see that can you see this coronoid process? This coronoid process is like a crest-like process. You can see it now here. So this coronoid process is articulating with the coronoid fossa of the humerus anteriorly, right? So that makes it easier to learn these two processes before we move on. So we have a hook-like olecranon process. I'll show that to you in a minute. This is the medial bone, the long bone. Always remember that. So we have a hook-like process that is known as the olecranon process. Moving on, we also have a coronoid process in red. You can see it here, or you can see it on this bone. This is the coronoid process. Why? Because it's articulating with the coronoid fossa anteriorly on the humerus, right? And then we have a smooth articular trochlear notch. So look at this. So this was my olecranon fossa, olecranon process, and then I had the coronoid process going to the coronoid fossa. And then the funny part is that the notch, the smooth notch is articulating with something. Oh, but what is it articulating with? Right? Can you see this? It's articulating with something, but what is it articulating with? Yes, the trochlea, right? We did the trochlea when we did humerus. So it's articulating with the trochlea, which is why it's called the trochlear notch, right? And then we have, what do we have? And then we have this notch here. Can you see this notch here? It's a very smooth notch. Can you appreciate this smooth notch here? It's present laterally. So when it's some notch is present laterally, it's called the radial notch. Why? Because it's articulating with the radius, right? Moving on, we know that the shaft is cylindrical. The important thing about the shaft here is that one part of it is smooth. You will feel the bone. You will see that one part is smooth and one part is quite sharp, like pretty sharp. I can feel it even on a synthetic bone. This is not a real bone. It's a synthetic one, but I can still feel the sharp border, right? So the sharp border is always the lateral border or the interosseous border. So why do we call it the interosseous border? Because as you remember, when we did joints, we studied that there's an interosseous membrane. What's an interosseous membrane? We have an interosseous membrane in the leg between the tibia and fibula. We also have an interosseous membrane in the forearm between the radius and ulna, right? So what is an interosseous membrane? It's a membrane that connects two joints, two bones, sorry. And wait a second. I'll show you the interosseous membrane picture for you guys. So you can see that this is the ulna and this is the radius, and in between them we have the interosseous membrane of the forearm. What is an interosseous membrane? It's basically a stout fibrous sheet of connected tissue that connects the radius and ulna. So basically it forms what kind of a joint? Do you remember when we did joints? We did, yes. So it's a syndesmosis joint, right? And it plays a vital role in the forearm stability, load sharing, and acts as an attachment point for deep forearm muscles. Attachments are not part of our syllabus right now, but we are still discussing this because this will come in handy when we discuss the attachments later on, right? Okay, moving on. So we've done the other parts, but now we have to do another thing, right? I told you what's the most important thing when we're discussing the bone, the side determination. Very good. But before we move on to the side determination, let's just cover the lower part of the ulna briefly. We haven't gone to it properly, but briefly we will say that the lower end has a head. I told you the special thing about ulna is that the head is really small, but with the other bones, the head is really big. Remember the humerus head, pretty big, right? We're forming the shoulder joint with the actual glenohumeral joint, right? But the head here is pretty small, right? And the lower end has a head and a styloid process. So you can remember this because it's pretty stylish, right? Like a stylish stiletto heel. It's just projecting, right? It's projecting posterior inferiorly from the head. How is it projecting? Posterior inferiorly from the head. Now, when we're saying posterior inferiorly, we're sort of getting into the sides now, right? So moving on to the side determination. How do you do the side determination of the ulna, which will get you like most of the marks when you start giving your bone viva? The side determination and anatomical position hold the bone vertically in such a way that the hook-like olecranon process projects upward, right? So my hook-like process is projecting upward. Can you see this here? This olecranon process, it's projecting upward, right? And then moving on, I have the trochlear notch, which was articulating with the trochlea of the humerus. So my trochlear notch, or sometimes they even call this like the semi-lunar notch. Why do they call it the semi-lunar? Lunar moon, semi-half. So this is like a half moon shape, right? So they're also calling it semi-lunar notch in some anatomical books. Okay, so we have the trochlear notch that faces forward. We have the hook-like olecranon process that projects upward. And then we have the sharp interosseous border. We haven't gone into borders yet, but we know that the shaft is smooth on one end and pretty sharp on one end. You will literally feel the sharpness here. Can you see this? Like it's pretty sharp. It's like you cannot not feel it. Okay. So the sharp end is faces laterally. Now, you know, this end is lateral. This end is lateral. This end goes up, projecting anteriorly. This projects, this coronoid process projects forward. The trochlear notch faces forward, right? And then the sharp interosseous border determines that this will be the lateral side. So if I know, let me see, this is the lateral part, right? And this is how it's supposed to be anteriorly placed. This is anterior and this is lateral. So and this is supposed to be the medial bone. Which side is it supposed to be? The medial bone. This is not the lateral bone. The lateral bone is radius. So if this is lateral, right, and this is the upper end of the bone, and this part is supposed to, all of this part is supposed to project forward. So this part is posterior, right? And this is lateral because this is a sharp border. So which side of the bone does it, which side of the body does it belong to? It belongs to the, very good, it belongs to the right side of the body, right? If I put this on the left side, what goes wrong? The lateral sharp border comes medially, but no, it's supposed to be laterally placed, right? So we did the side determination, which I told you is very important, right? So what's the function of the ulna? Why do we have this weird looking, very thin, long bone called ulna? So it basically stabilizes the forearm by gripping the lower end of the humerus and its trochlear notch. So I told you that it literally grips the humerus, right, in the trochlear notch. And that's why it stabilizes your forearm, right? And it also acts as weight transmission factor, right? So it transmits the weight from the forearm to the humerus, right? So this is like the function of the ulna. Now we'll move on to the features of the ulna. But before that, let's talk about the olecranon process for a bit, right? Let's go back to the olecranon process here. Can you see this? No, wait. This part, the olecranon process, what's special about it? It's a beak-like upward projection at the upper part of the ulna, right? It has 5 surfaces. When you look at the olecranon, clearly, we can see that this part has 5 surfaces. Interesting, right? So it has a superior surface, it has an inferior surface, it has an anterior surface, a lateral, and a medial surface, right? This has 5 surfaces. This olectron process itself has 5 surfaces, right? It articulates, the special part of olectron process is that it articulates with trochlea of humerus to form the humero-ulnar part of elbow joint. And we've done that before, right? Look at this. So it's forming the humero-ulnar part of the elbow joint. So this is the humero-ulnar part of the elbow joint. And when we see the anterior surface of the hook-like process, the anterior surface of the electron process, what's special about it, that it's concave. Can you appreciate it here? It's concave, right? Right? It's a little concave. And what's special about this part, this is covered by hyaline cartilage, and together with the upper surface of coronoid process, it forms a trochlear notch. So this part and this part, this together forms a trochlear notch. That's the importance of this part, right? So this anterior surface of the olectron process and the coronoid process both form the trochlear notch, right? That's all I'm basically saying right now. So after the olectron process, let's move on to another process which is pretty important, and that is your process, right? So now let's talk about this coronoid process. um I think I'll pull this picture up for you. This is clearer. So this is the coronoid process. Can you see it? Like, it's very clear, right? So what is this? It's a shelf-like process that projects forward from the upper part of the shaft. So this is the shaft, and this is projecting forward from the upper part of the shaft. And why are we calling it coronoid? I told you coronoid means crow's beak in Greek, and this literally looks like a beak. Like, we can't even lie. This literally looks like a beak. This part also has 4 surfaces. So we have a superior, anterior, medial, and lateral surface, right? So together with the anterior surface of the olectron process, that forms the trochlear notch. So the coronoid process and the olectron process both together form the trochlear notch, right? So moving on, let's get to the shaft of the ulna. Now, moving on to the shaft of the ulna, let me go back to the presentation. All right, so this is the shaft of the ulna, right? So when we talk about the shaft of the ulna, we know that it's cylindrical and it narrows above downwards, right? So when we're going from above to downwards, the bone is sort of narrowing, right? It's getting narrower and narrower till we reach the head, right? So it narrows downward, and it has 3 borders. Which 3 borders? It has an anterior border and a lateral border, which we've already done. We've done that. The lateral border is really sharp and it was attaching the interosseous membrane, and that's why you also call it the interosseous border. So it has an anterior border, which we will study now, a posterior border that we've not done yet, and then it has an interosseous or lateral border. And since it has 3 borders, it also has 3 surfaces, the anterior, posterior, and medial. Now we're talking about the anterior border, right? So we're talking about the anterior border. Look at this image. So we have this pink line is the anterior border, right? Let's just look at the ulna for a bit. So this is the anterior view. This is the posterior view. I'm talking about the anterior view right now with the hook-like projection faced forward. We have a superior side and an inferior side, a left side and a right side, right? Now let's look at the ulna anteriorly, right? So the anterior border, where does it start from? It extends from the ulnar tuberosity. So this part, the coronoid process, it goes down to show you an ulnar tuberosity. I'll explain the ulnar tuberosity, okay, in an image. Wait. The image up for you. Can you see this ulnar tuberosity? So the coronoid process itself sort of extends to form the ulnar tuberosity. But what is the ulnar tuberosity? It's like a rough eminence on the proximal end of the ulna. Can you see this? This rough eminence on the proximal end of the ulna. It sort of is at the anterior inferior surface of the coronoid process. Can you see it? So that's the tuberosity of the ulna. Why is the ulnar tuberosity important? Because that's where the anterior border of the ulna starts from, right? So it sort of occurs at the junction of the anterior inferior surface of the coronoid process, which was this, with the front of the body, and this is the front of the body. So this is the ulnar tuberosity. The anterior border starts from the ulnar tuberosity, and let me go back and show you the anterior border. So it starts from the ulnar tuberosity, and where does it go? Where does it end? To the base of the styloid process. Can you see the styloid process here? Right? So to the base of the styloid process, we're sort of starting from here, right? And we're going all the way down to the base of the styloid process. Look at it here, here. So this pink border anteriorly is the anterior border. Moving on, let's look at the posterior border. So obviously, by its name, the posterior border is present posteriorly. It extends from the apex of the triangular posterior surface of olecranon process. I told you the olecranon process has like 5 surfaces, right? And the posterior surface is triangular. Can you see there's a triangular surface here? So from the triangular surface of the olecranon process, the posterior border extends, right? It extends posteriorly till which part? To the back of the styloid process, just at the back of the styloid process posteriorly. So starting from the triangular posterior surface of the olecranon hook-like process, going back to the back, going down to the back of the styloid process. That's your posterior border. You can see it in this red line here, right? This is your posterior border. Moving on to the next border, which is your next border? The lateral interosseous border, which we've already done. So it is basically the lateral interosseous border is sharp in the upper part, and it's sort of ill-defined in the lower part. It's not very well defined in the lower part. And that's all like you sort of need to know about the 3 borders for now, right? Now we have the surfaces. So we've done 3 borders: the anterior border, the posterior border, and the lateral border. Now we'll do the 3 surfaces. So the ulna has 3 surfaces: anterior, posterior, and medial. So the anterior surface lies between the anterior and interosseous border. So if the anterior border is here, and this is the anterior border, and this is the interosseous border. So between them lies the anterior surface. So where does it lie here? So this is the anterior border, and this is the lateral interosseous border. So this area where my mouse is right now going all along, this area is the anterior surface according to our anatomy books, okay? And the posterior surface and the medial surface, right? But first we'll see what is present on the anterior surface. So the anterior surface lies between the anterior and interosseous borders, and there's a nutrient foramen that is present in the upper part of this anterior surface, right? Let me see if I can show it to you on this synthetic bone. Not really, I can't. But we can just remember that there's a nutrient foramen that's present in the upper part of the anterior surface, okay? There's also an oblique ridge that is present in the lower 1/4 of the surface. I can see that here. Look at this here. Can you see it here? So there's an oblique ridge that's present in the lower 1/4 of the surface, the anterior surface. Okay. Moving on to the medial surface. Now, where does the medial surface lie? It lies between the anterior and posterior border. So if we know that this is the lateral border, we know that there's a posterior border also, right? So between the anterior and posterior border, there's a medial surface. Why is it called the medial surface? Because it's on the medial side, literally it's projecting towards the midline of the body. And what's important about this, it is a muscle called the flexor digitorum profundus, which originates from the upper 3/4 of this medial surface, right? Not important for you right now, but when you do the attachments, this information will come in handy. Okay, now moving on to the posterior surface. Where is the posterior surface present itself at? Whatever was left, right? So we run the anterior border that was between the anterior border and the lateral border. The medial side, the medial border, medial surface was between the anterior border and the posterior border, right? So what's left? The surface between the posterior and interosseous border, the lateral border, right? That's left. The other 2 surfaces we've done. So that's the posterior surface. Okay. Now we have subdivisions of this posterior surface. When we talk about the posterior surface, it's pretty big. So we have the subdivisions. We can like subdivide it. This area between the posterior border and the lateral interosseous border is the posterior surface, and we subdivide it, right? Supinator crest. Let me show it to you here. Can you see the supinator tuberosity and the supinator crest here? right? So when we're talking about the supinator crest, you remember how we did the lateral introssus border, which was marked in the upper area by a sharp line, and in the downwards area, it was like ill-defined. So in the upper area, the supinator crest or ridge is the prominent ridge that's located along the lateral aspect of the body of the ulna. So this is the supinator crest, right? Where does it extend from? It extends inferiorly from the posterior edge of the radial notch. We saw that we saw that this was the radial notch, right? So beneath it is the supinator crest. It extends inferiorly from the radial notch, from the posterior edge of the radial notch to the introssus border of the ulna. So it sort of forms the upper part of the lateral introssus border. Both the supinator crest and the introssus border or the lateral border of ulna separate the anterior and posterior surfaces of the ulna because it's the lateral border. So what is it separating? It's separating the anterior surface from the posterior surface, right? So what's important about the supinator crest? The supinator crest, it provides an origin for the supinator muscle, which is very important to for the forearm to supinate, right? We'll do the muscles later, but it's very important for you to remember this because it sort of even forms a part of the posterior surface. So the posterior surface lies between the posterior introssus borders and its subdivisions. So there's an oblique line that extends, there's an oblique line, you can see it here, right? So there's an oblique line that extends from the supinator crest, right, to the posterior border. And it divides the posterior surface into a smaller upper area and a larger lower area, right? So this crest sort of divides the posterior surface into a smaller upper area and a larger lower area, right? This is the posterior surface. Now, what is important about this? There's a vertical ridge, right? Here we can see there's a vertical ridge that divides the larger lower area into two further surfaces. There's a medial area that's adjoining to the posterior border, and there's a lateral area adjoining to the lateral border. ठीक हो गया? Um, I think these 4 points are going to be clear when you have the bone in your own hand, but I'll try to pull up a picture here for you to make it clearer. The supinator crest, there's an oblique line extending from this supinator crest to the posterior border behind. So it's going, this oblique line is going back posteriorly to the posterior border and is dividing the posterior surface into a smaller upper area. And then we go down and we see posteriorly on this bone, there will be a larger lower area. Now the larger lower area is again divided into a medial area and a lateral area. I will show it to you on this. It is very clear on this bone. Can you see this? Now this is the posterior surface. This is the posterior surface, right? So the posterior surface, right next to the lateral border, the posterior surface, the larger lower area is divided into two further areas by a vertical ridge, right? So the medial area of this vertical ridge adjoins to the posterior border, and the lateral surface of this the lateral area of this posterior surface adjoins to the lateral border. Okay? Even if you don't get these 4 parts of the posterior surface, and as long as you can explain that you have found the posterior surface, which is located between the lateral introssus border and the posterior border, it's good enough. Okay, now coming to the lower end, we can see that the lower end is slightly expanded, right? It has a head, and it has a styloid process. The head of the ulna presents an articular smooth convex surface on the lateral side. So when we talk about the lateral side, we're going to follow the lateral border, the sharp lateral border, and we can see that the head, it shows up a smooth surface, a smooth convex surface on the lateral side. Why is it important? Because it articulates with the ulnar notch of lower end of radius to form the inferior radio-ulnar joint. I'll show that to you here. Okay, look at that here. Okay, so this is that ulnar notch. Why is this ulnar notch important? Because it articulates with the ulnar notch of the lower end of radius. Here, this is the ulnar notch of the lower end of the radius, and this part forms the inferior radio-ulnar joint, right? This was a superior radio-ulnar joint, and this is the inferior radio-ulnar joint. Okay, the inferior surface also has a semilunar area. Can I please show it to you here? Here, it has a semilunar area. Can you appreciate that here? Here, it has a semilunar area. The inferior surface has a semilunar area that laterally articulates with the superior surface of a triangular articular disc. So this is triangular articular disc here, and the inferior surface articulates with the superior surface of a triangular articular disc. I'll show it to you in an image if I can find one. Um, Moving on, when we're talking about the lower end of the head, ulna, we know that there's a head. The head forms the inferior radioulnar joint, and the attachment of the head is that it attaches to the apex of the triangular articular disc between the inferior radioulnar joint. So there's a radioulnar joint, there's going to be a triangular disc in between it, right? And this head is attaching to it. There's a semilunar the semilunar surface here, the inferior surface, and that is attaching to the apex of triangular articulate disc. Okay. Now the styloid process, the stylish styloid process, it has a groove on the lateral side. There's a groove on the lateral side of the styloid process. That is important because it forms a passage. The styloid process forms a passage for the flexor carpi ulnaris. That's an important muscle that we'll do later on. So it sort of gives a passage to the flexor carpi ulnaris. Now, moving on, there's a styloid process. What's important about the styloid process? It projects downward. It's literally projecting downward from posterior medial aspects of the lower end, right? Posterior medial aspect of the lower end, not the lateral side, right? Can you see this here? Since the ulna itself is the medial bone, this part is going to be the posterior medial aspect, right? So it's the styloid process projects downward from the posterior medial aspects of the lower end, right? Again, I was saying that it has a groove that allows the passage of the tendon of the extensor carpi ulnaris. And then what's important about the ulna itself, we talk about ossification of the bone, the developing part of the bone. So we have to know that the ulna ossifies from one primary center and two secondary centers, right? Shaft, and that appears during the 8th week of intrauterine life. Can you see the 8 written here? So there's a primary center here that appears during the 8th week of intrauterine life, and then we have secondary centers. There's secondary center here, and there's a secondary center here. Secondary center near the olecranon process or the upper end appears at one for the upper end appears during the 9th year, the 9th or the 10th year of a human's life. And the one for the lower end appears by the 6th year of human life. But it fuses with the shaft by the 18th year. Okay, by the 16th to 18th years, this part fuses with the shaft, and the lower end fuses by the 20th year. So mostly when you want to know if you're going to grow taller from this point onwards or not, you can get an x-ray done for your forearm bones, and if they're fused already, you know that you've already reached your maximum height. Unless you are planning to do a lot of muscular exercises, you can grow an inch or taller because you sort of fix your posture, so you do gain like an inch or two. But if your upper and lower ends of the ulna are fused already, they sort of this means that the height for a human being is sort of at the growing end kind of area, right? Now I think that's enough for the ulna. If I have to relay some fractures to you, I will be doing that in the next part of this video, but I think I've said enough. So thank you guys, take care.